Hey guys, this is Kevin Budiszewski, and this is Cystinuria. So cystinuria is an autosomal recessive defect in the proximal convoluted tubule and intestinal reabsorption of amino acids, which include cysteine, ornithine, lysine, and arginine. To remember these amino acids, you can use the memory aid COLA. I like to take this even a step further and think of Coca-Cola, where the first and the last letter in cystinuria are C and A, and as is the case with coca. Therefore, cystinuria is the Coca-Cola disease. The defect in cystinuria ultimately leads to the excretion of these 4 amino acids in the urine. One of the most important effects of this disease is that cysteine can precipitate and form kidney stones, which are also called cystine staghorn caliculi. So what is the difference between cysteine with an EI and cysteine with just an I? Well, the cysteine with an EI is an amino acid, whereas the one with just an I is a dimer of 2 cysteine amino acids that are connected by a disulfide bond. So here's a nephrology question for you. What do cysteine kidney stones look like on microscopy? Well, patients with cysteine kidney stones can have hexagonal-shaped crystals on urinalysis. What's the diagnostic step for cystinuria? That would be the urinary cyanide nitroprusside test. Good. What would be the treatment? This is a little bit tougher, but patients can actually be given acetazolamide or citrate to alkalinize the urine. Alkalinizing the urine helps cleave disulfide bonds in cysteine to form 2 cysteine molecules. So it was always hard for me to remember which stones precipitate in acidic versus basic urine, so what intervention decreases the incidence of every single kidney stone? You guys should remember that the solution to pollution is dilution, so drink water and dilute the urine.